residents will learn how to interpret surgical pathology, cytopathology, and hematopathology specimens, both at the microscope as well as all the ancillary testing that is needed to make a complete diagnosis. We have a full representation of all organ systems so that you'll be competent in all aspects of the body. We have CP rotations so that you'll be able to learn how laboratory tests are conducted, how the instruments work, how they're interpreted, and also how we communicate this and collaborate with our clinical colleagues about our findings. Each resident presents 1 grand rounds every year. And so they're, in the first years, they might select something from an autopsy. They might select a case that was very interesting or challenging during their surg path or heme path or blood banking. Pathology faculty are fellowship trained, and we are excited about our specialties, and we are excited to teach residents all about it.
The faculty have many different subspecialty training backgrounds, and this allows for a strong teaching environment.
So we maintain a very open and welcoming and collegial environment. We enjoy that amongst ourselves as faculty, and we want our residents to also be included in that network of collegiality. It's much easier to learn when you can pose questions and have them answered. We want to facilitate residents' learning, and the best way to do that is within a welcoming environment.
I love working at Tulane, and I think for many reasons, but what stands out to me the most is the dynamic that the residents have with each other, the faculty, and the other staff that we work with.
Our program is special because of its small size. This allows for many direct one-on-one interactions with attending pathologists.
Collegiality is one thing that really does stand out in this department. I know this stood out to me 20 years ago when I interviewed here for a faculty position, and it hasn't changed a bit. And the reason is that Tulane as a whole supports this. It permeates the entire system, so that our department has a great working group within our department, and we enjoy great working relationships from our department to other departments.
The competitive nature that you see a lot of times in other residency programs within pathology doesn't exist here, and I think what that does is it makes working here a lot more productive. It makes learning enjoyable and less stressful.
So as a first-year resident, you might be collaborating on a first-name basis with NIH. And 4 years later, you have the molecular results, and you present that as your 4th-year grand rounds.
You should choose this program if you want to work in a comfortable environment which allows for residents to really get to know one another and their attending faculty.
The residents have competed favorably for good fellowship positions. So after fellowships, our residents have landed their dream jobs in all manner of locations, both here in New Orleans at Tulane, University Medical Center, Ochsner, the Jefferson Parish Coroner's Office, as well as around the country. New Orleans offers a wide diversity of material, and you will see a wide range of cases from our different hospitals.
One of the other amazing parts to going to Tulane for residency is that you get to live in New Orleans, which is one of the most amazing cities in the country. It's rich in history, art, activities. There's something going on every single day. And, classically New Orleans is known for Mardi Gras, but there's festivals all year round of all different types. It's very enriching, it's exciting, and life outside of work is really fun here. And that's something that you won't be able to get in the same way anywhere else.
New Orleans offers, of course, a vibrant culture. There's something for everyone. It's a generous culture. There's the whole feeling of lagniappe, something extra. Tulane is a wonderful place to train. I think our residents feel vibrant every day that they're here. We know residency and medical training has its ups and its downs. You want to have more ups than downs. And that when it gets difficult, there's plenty of support. There's plenty of ways to find your answers and to develop skills. And as you look back, you'll be amazed at how fast you've grown and how far you've come. Our residents have great opportunities with fellowships, and their careers. They've found careers, their dream jobs all across the country, and I know that you would too. We'd love to have you come and interview with us. So please take a look at our website, give us a call.